one major issue that we are huge supporters of, as I'm sure you know, is universal health care. And obviously, the New York Health Act is the one policy in the progressive wing of the Democratic Party that has made some waves. It's obviously not getting anywhere because the pharma and the private insurance lobby is so big. From a libertarian perspective, how do you see the New York Health Act, and how do you see universal health care overall? Because our goal is to eliminate the for-profit middlemen in between us and our doctors. We do not want government-run health care. We just want government single-payer funded healthcare.
Correct.
Get the corruption out of the equation.
So you would be in favor more of a Canadian style versus a UK style, because UK, the government owns the hospitals.
Yeah. The country that actually has it the best, believe it or not, is France. In terms of the overall rating system of the world, they have a national single-payer system, and they also have a private supplemental market. If somebody wants to get some additional coverage that's not required, that's fine. I don't have a problem with that. But the basics of healthcare and not having to, our last guest that we just had on, Michelle Grimm, who's a state representative in Ohio, was successfully able to cancel untold amounts of medical debt. The fact that we have medical debt is nuts.
That shouldn't be a thing.
The fact that that's only a thing in the United States is crazy. And if we had a single payer system, it wouldn't exist.
I'm very open-minded, and I just have this thought that if we really wanted to do it, we could not only do it, but we could probably do it better than any other country and actually figure out a way to make like all the best parts of those systems work for us. That's what I think.
Right. Well, I'm not sure about the New York State Health Act, but usually these state level programs, even if they get voted in, end up never materializing because they end up too costly, at least for a state government to set up. Now, we'll likely disagree on the costs at the federal level, but like, I don't have an issue with people advocating for universal health care as long as they advocate for it in an honest way. Because one of the things that people don't realize is that the American expectation of what you get out of a healthcare system is significantly higher than what you would get out of a European style system, which is a lean healthcare system that's supposed to cover your basic needs. And you pointed to one of those rating systems. I'm not exactly sure which one you're referring to, but what I often find when I look into those rating systems is that there's a lot of biased metrics in order to produce the outcome that America is the lowest ranked out of all the systems. I'm not saying that we don't have problems or anything like that, but a perfect example of this would be when they factor in infant mortality, but they don't adjust infant mortality as it pertains to the different countries. So like in America, we have a pro-life movement. I'm sure you guys have heard about it. And because of that pro-life movement, the way we count infant mortality is if it's alive for a second and it dies, then that is infant mortality. Like that counts in our statistics.
And you're saying other countries don't count that as a live birth.
Yeah. So in France, as an example that you brought up, they actually have a threshold of an amount of weeks that it's alive. That it's been like through the process. So if we have like a birth that starts at 14 weeks and then the baby dies because 14 weeks, like Jesus Christ, then we count that in infant mortality. I believe France has a 20-week standard where if it's anything below that, it doesn't necessarily count. Some European countries have a standard where they only count a birth if it's alive for 48 hours. Otherwise, they count it as some other different way. And you really can't compare those apples to apples when they're not apples to apples statistics. And according to the CDC, if we counted our, infant mortality in the same way that the average European country would have, we would actually be quite comparable to like Sweden or one of those Scandinavian countries. So like, I do have issues with individual metrics and like what they're actually measuring in terms of a comparison. But overall, as long as you're advocating for what the European model or like an Australian model is, which very few people do, which is a lean, hopefully efficient healthcare system that covers your basic needs. But you have to pull back your expectations of what you think you're going to get from a healthcare system, then I'm fine with people advocating for it, even if I might disagree.
Yeah, I mean, I understand completely what that is. I actually had a friend from high school that I know, and two of her kids were born in Spain when she was living there, and one of her kids was born here. And like the maternity and all that in Spain was, You didn't have private rooms, and it was definitely more. But yet, and here's what's interesting, and this is somebody with means and was able to have a private room here and all of that stuff with the baby born here. She preferred it there because overall, she just said the experience was just so much better as an experience. So even though, yes, it was more, I guess, what we would consider to be bare bones, I guess those bones were more quality. Like, I don't know, like she just said it was the way that she was treated, the way, because when everything isn't about charging you for things, because now when you're in a hospital, you have like your scan code. And every time that they charge you, they scan you, they scan the thing, like all of the administrative stuff, all of that crap really does not add to a pleasant experience in especially when you're having a baby. Like it's just crap. Oh. So I actually like the idea of having that. And yeah, if people want to have private, have private. I don't mind there being private as an option. Like you can go have your own personal thing.
I mean, there are things that people might want to get that would not be considered, as you're saying, Sean, and I agree 1,000%. Being able to go to the doctor 2 or 3 times a year to make sure that you're healthy and get a basic checkup and not have to, and the fact that we have a for-profit hospital system that shouldn't exist, those are the types of things that I think universally, and this is where we constantly talk on our program about how progressives and libertarians actually cross over in a lot of places, believe it or not.
It's way more financially efficient and economically efficient to have single-payer healthcare.
The whole libertarian mantra is to be the most fiscally responsible that you can possibly be. And having a universal system without the excess fat is one of the main ways that I believe that this crossover can happen. But as you know, in our country, because of our completely engulfed in corporate power system that we have, it isn't just one layer. It's like you can have healthcare, but you still have billions and billions in subsidies to the fast food industry, which is going to continue to cause these health problems and these health costs that will stay where they are and make it very difficult for it to be a reasonably priced single payer system. So if you're going to knock down one domino, I think you got to knock down quite a few. How do you see it?
Right. I mean, I think there's upsides and downsides, and people should acknowledge the trade-offs. Like, so before, like, you know, I just want people to do that before they get into this debate, because a lot of people have a very pie in the sky view of what the Europeans actually have. But I will say there are certain reforms, because one of the biggest problems, in my opinion, about the healthcare market is that it functions almost like no other market in the country. Now, I understand that there's a lot of people who are under the belief that demand is inelastic. So because people are always demanding healthcare, they think that market forces don't work in terms of the healthcare market. But if you look at optical care, which again is not as essential as other forms of healthcare, prices have consistently gone down. Like you can go into, and I don't recommend BJ specifically, or a Costco or a CVS, and get your eyes examined. Now, I can't vouch for the quality of all those places, because I went into a BJ's and got my eyes examined, and they told me I was legally blind, and then I had to get the exam all over again. So that was a waste of $80. But still, $80 to get a prescription for eyes when it actually works is not that bad of a deal. And so in terms of like optometry, we've seen, or ophthalmology, whatever it's called, we've seen prices come down and market forces work. And one of the things that I think we should not be so hesitant against is certain market reforms, even if they sound counterintuitive. So one of the things that I learned is that Medicare can't negotiate prescription drugs, right? And I think that they should be able to. And I look at Joe Biden's proposal, and I think that his proposal is ridiculous, because it's like you can negotiate 10 drugs maybe in 2026 and then 10 more in like 2030. And that's supposed to be a solution. And they put out, by the way, that you're going to save this much money on prescription drugs when none of those are going to materialize. And we have no idea what, you know, future legislatures are going to do when that negotiation period comes up. However, we have a Medicaid system that, I'm sorry, I see your lips moving, but I can't hear you.
No, I'm sorry. Go. It was a sidebar.
It's a quip.
Oh, so Medicaid actually mandates that they get the cheapest drug prices on the market. And I initially was like, oh, well, that makes sense. Medicaid is for people with no money, and we don't want people to, you know, basically extort money out of the Medicaid system. But the problem is the way that plays out is that because they know that Medicaid is going to have to get the cheapest drugs, they end up raising the drug prices to such a high degree that once they get through with the insurance negotiations, they still feel like they can make money off of Medicaid. So a lot of people will point out that prescription drug companies have like this level of profits during the course of the year, but they don't acknowledge that by the time you get to the end of the year, these prescription drug companies have to throw out a crap ton of rebates to Medicaid that significantly cut into that. So I think negotiating your prescription drug prices is fine, but a blanket mandate that you get the cheapest one actually has unintended consequences that make us all pay more for prescription drugs. Also, we need to be able to import insulin from, scary countries like Canada or the UK or any of these supposed third world hellholes that supposedly don't make insulin right. Like, there's a bunch of different things that we institute that make our market not a market, and it's disastrous.
Thanks for watching. If you want to support our mission to transform politics into service, please like this video, subscribe, follow us on social media, and consider joining our Patreon, where you'll get early access to our interviews as well as other exclusive content. Links are in the description. Peace out.